TAVI or Transcatheter Aortic Valve Implantation. So TAVI has got several names called as Transcatheter Aortic Valve Implantation or TAVI, Percutaneous Aortic Valve Replacement or Aortic Valve Replacement TAVR. It is the replacement of the aortic valve of the heart through the blood vessels as opposed to the replacement by the open heart surgery. And the replacement valve is delivered via one of the several access methods. It could be transfemoral in the upper leg, transapical through the wall of the heart, subclavian beneath the collarbone, direct aortic through the minimally invasive surgical incision into the aorta, and transcaval through from a temporary hole in the aorta near the belly button through a vein in the upper leg are common other examples. Severe symptomatic aortic stenosis carries a poor prognosis. Until recently, the surgical aortic valve replacement was the standard and the only care of option for the adults with severe symptomatic aortic stenosis. However, the risks associated with the surgical aortic valve replacement are increased in elderly patients and those of the concomitant with severe systolic heart failure or coronary artery disease, as well as the people with comorbidities such as CVA, peripheral arterial disease, and chronic kidney disease and chronic respiratory dysfunction. For these patients, TAVI has got a better option with better prognosis. So the team approach could be with the interventional cardiologists, imaging cardiologists, vascular surgeons, cardiac surgeons, anesthesiologists, making a heart team, and the role is more or less the same in all the hospital, but the heart team members may vary from trust to trust. So one has to determine the severity of the aortic stenosis, assess the aortic valve morphology, estimate the annular size, distance from valve to main orifice, and discovery of severe aortic atheroma, which may mandate the transapical approach. These are all done by the routine investigation via the transthoracic or transesophageal echocardiography or CT angiography. Percutaneous AV replacement, the role of transesophageal echocardiography is to reassess the annular diameter for critical sizing, monitor the deployment of valve, verify the correct positioning, coaxial alignment, and direct impingement on the coronaries should be avoided. Assess the severity and location of aortic regurgitation, assess the leaflet motion of the deployed valve, measure the gradient transgastric views, and detect the new regional wall motion abnormalities and detection of complications. Percutaneous AV replacement, the complications include the vascular complication, stroke, dislodgement of the aortic atheroma, thrombus formation of the catheter wires, etc., valve migration, myocardial ischemia from the coronary obstruction, damage to mitral valve, and AV block. So percutaneous AV approach, echo is to be done to see the sigmoid septum, MV structure and function, calcification, LV apical thrombus, occurrence of thrombi on the catheter, wired not through the mitral apparatus. So this is an example of coaxial and non-coaxial view, and this is the view showing the deployment of the valve. Percutaneous transaortic valve replacement. So the figure shows AV replacement to avoid the impingement on the coronary arteries or ostia to impede the motion of anterior mitral leaflet. Prosthesis deployed by inflating the delivery balloon, and balloon is deflated and rapidly withdrawn. So there is increasing need in the next 10 years as the aging population is increase of the world population and underdiagnosed in upcoming countries like China and India. Alan Carriber was one of the driving force for the catheter-based therapies for the valvular heart disease since mid-1980s, pioneered the development of Carriber Edwards heart valve, performed first PTVA in 2002. Percutaneous aortic valve could be core valve, Edwards-Sapien, direct flow, Lotus, Managua, Enable, Percival, and Jana, made by different technologies. One of the important trial is partner trial, placement of aortic transcatheter valve trial. So partner algorithm includes severe AS with high risk patient, could be operable, high risk, non-operable. Operable high risk could be percutaneous or surgery high risk. Non-operable could be percutaneous AVR or medical therapy. So indications for percutaneous aortic valve are severe AS from degenerative disease, symptomatic aortic valve area less than 0.8, Vmax greater than 4 centimeters, or mean gradient more than 40 millimeters of mercury, surgical mortality of more than 20%. So Edwards-Sapien valve using the Retroflex 3 transfemoral delivery system. Procedural steps include balloon valvuloplasty, aortic arch navigation, native valve crossing, valve deployment, and final assessment. Edwards-Sapien THV using the Ascendra transapical delivery systems. The steps are direct access the apex, balloon valvuloplasty, native valve crossing, and valve deployment and final assessment. It's a rapidly emergent field with improving technology, improved patient selection, and growing procedural experiences. So the next generation of the transfemoral valve delivery system, the Retroflex, has been improved to Retroflex 2, which offers the greatly improved native valve crossability, smoother tracking, improved handle of functionality, fewer system components, continued advancement for THV program. There is a marked improvement and clinical improvement. Careful selection and screening is essential. PE is important role during the procedure in some centers, and procedural success rate is around 90%. And we have only short-term results, and we need to analyze the long-term results in future. So general anesthesia or awake patient can be offered general anesthesia or could be awake during the procedure, and one avoids surgery, steep learning curve, and it's still in the early stages. So Edwards-Sapien valve is also used in TAVI. It's a balloon expandable stainless steel stent, fabric sealing cuff, bovine pericardial leaflet, and size is 23 and 26 millimeters. Core valve prosthesis, self-expanding nitinol alloy stent, porcine pericardial leaflets, pericardial sealing cuff, 50 millimeter long, waist in the middle part, two sizes 26 millimeter and 29 millimeter. Thank you.